Welcome to this explainer. I'm your expert health coverage advisor, and look, today we are diving into something really powerful, an actual viable alternative to traditional health insurance. If you've been searching for a real breakdown of what Medi-Share is, how it actually works day to day, and why having a dedicated guide makes all the difference when you enroll, well, you're in exactly the right place. We're going to cut through the noise, break down the mechanics, and look at the real numbers to give you a crystal clear understanding of this whole model. So, let's jump right in.
Let me ask you this. Are you just completely exhausted by the rising costs and endless frustrations of traditional health insurance? Honestly, it's a reality so many of us are dealing with right now. You've got these high monthly premiums that literally just seem to go up every single year, restrictive networks telling you exactly which doctors you can and can't see, and all that impersonal corporate red tape that makes getting basic care feel like an uphill battle. It's incredibly frustrating, right? Well, you are definitely not alone in feeling this way. And honestly, that shared frustration is exactly why alternative models have been gaining so much massive traction lately.
Let's look at the core differences here. The traditional system, as we all know, is pretty much defined by rising costs, super rigid networks, and this really impersonal approach. But the healthcare sharing model, it completely flips the script. We're talking about members experiencing up to a 50% savings on their monthly medical expenses. 50%. Plus, it gives you nationwide flexibility. No more strict network boundaries boxing you in. And the whole thing is built entirely around community-aligned values. It really is a huge paradigm shift, moving away from a cold corporate transaction to a genuine community-driven safety net.
Now you're going to hear the acronym HCSM a lot, which stands for Healthcare Sharing Ministry. If you're not super familiar with the term, it's actually a legally recognized model, officially identified right in the Affordable Care Act. It's where members who share aligned values come together to directly share each other's medical bills. But here is what's absolutely crucial to note. Medi-Share isn't just any HCSM. The official documents highlight that it's the very first nationally accredited healthcare sharing ministry. And that accreditation, that gives you a massive added layer of trust and structured oversight for the entire process.
To truly grasp what Medi-Share is all about, we really have to look at its foundation. The whole structure is designed to bring Christians together to share God's blessings and burdens. The guidelines actually stated beautifully, saying, for centuries, Christians all over the world have shared their lives, resources, and blessings as first outlined in the book of Acts. So, you see, this isn't some new, wild, experimental concept. It's really the modern, highly structured application of a centuries-old biblical mandate to care for one another, just translated perfectly into today's healthcare environment.
And that brings us to the sheer scale of this thing. Because Medi-Share is not some small niche experiment. No way! It is a massive, thriving network of over 400,000 members across America. Think about that for a second. When you join, you're stepping into this huge, nationwide community that is actively supporting each other. It really gives you that incredible peace of mind just knowing hundreds of thousands of people are standing together, sharing their resources, and genuinely having your back in times of medical need.
But of course, the big question is always, does this model actually work financially? Well, how about $9.6 billion? That staggering number is the total amount of medical bills shared and discounted since Medi-Share started way back in 1993. To put that into perspective, they are processing over $50 million every single month. In just one recent fiscal year alone, over $138 million was shared for cancer and heart disease, and nearly $28 million for births. So yeah, that figure is absolute proof. The system is financially viable, and it is making an unbelievable impact on real families.
Okay, so seeing huge numbers like 9.6 billion is definitely impressive, but you're probably sitting there wondering, all right, but how does medical bill sharing actually work day to day? Let's pivot from the big picture for a second and just break down the practical mechanics. I want to translate some of this complex healthcare jargon into simple, everyday terms, so you know exactly what happens when you or a family member actually needs to go to the doctor.
Let's start with a key term you really need to know, the annual household portion, or AHP. Now, you can think of this as Medi-Share's version of a deductible, but it has a massive advantage. The AHP is basically the specific dollar amount your family agrees to pay toward eligible medical bills before the community steps in to share the rest. But here is the real game changer that sets Medi-Share apart. This is one aggregate amount per family. Unlike typical insurance, there are absolutely no confusing per person or per incident charges to sweat over. Once your family meets that single AHP, which just resets every 12 months, you move right into the sharing phase. That's it.
So let's look at exactly how that plays out in reality. Step 1. You go to the doctor and just present your card. And this is awesome because Medi-Share really stands apart from a lot of other HSMs by offering direct billing. That means the provider sends the bill directly to Medi-Share, so you aren't stuck paying the whole thing out of pocket upfront and waiting for a reimbursement check. Step 2. The bill gets processed, a network discount is applied, and that discounted amount goes straight towards your AHP. And finally, Step 3. Once your AHP is met, 100% of your eligible medical bills are shared by the community. It is seriously just a beautifully streamlined, transparent process.
All right, now that we've got a solid grip on the foundational mechanics, let's shift gears for a second. Standard bill sharing is fantastic on its own, but Medi-Share actually layers on several unique features that unlock some incredible perks for its members. And honestly, these added benefits are where members really feel the day-to-day value of being part of this program.
Let's run through these standout benefits. First up, nationwide PPO flexibility. You get the freedom to choose any provider or facility across the country. Huge, right? Second, there are absolutely no annual caps or lifetime limits on eligible sharing. If you are hit with a major medical event, 100% of eligible bill amounts are shared, period. Third, telebehavioral health. True to that biblical mandate to carry each other's burdens, you get virtual access to licensed mental health professionals. And finally, the Healthcare Blue Book. We all know medical prices are all over the place, but this tool gives you total visibility into provider pricing and quality. It actually helps members save an average of $792 on medical procedures.
And really, all of these amazing benefits bring us right back to this incredible metric. Because Medi-Share doesn't operate with the bloated overhead and massive profit margins of traditional corporate insurance, and because it relies on a health-conscious, values-aligned community, members routinely save up to 50% a month on their medical expenses. When you combine that kind of monthly savings with zero lifetime limits and just a single family AHP, the financial relief for families is literally profound. It's a total game changer. At this point, you might be nodding along thinking, okay, this sounds like a great fit. But before you jump right in, I want to address a really crucial question. Why should you navigate the enrollment process with a dedicated guide? Look, you certainly could go to the website and try to figure it all out and enroll on your own. But your health coverage is incredibly important, and making a tiny mistake during the application process can lead to massive headaches down the road. And that is exactly where my role as an expert health coverage advisor comes in.
Enrolling with me means you get a dedicated, personalized guide in your corner. These guidelines have specific nuances that really need to be fully understood. Take pre-existing conditions, for example. The rules state that a member must faithfully share for 36 consecutive months before up to $100,000 per year becomes eligible for sharing for a pre-existing condition. I help translate rules exactly like that so you never have any surprises. Or hey, if you're a senior, I can help you seamlessly navigate Medi-Share 65+, making sure it integrates perfectly as a secondary to your Medicare Parts A and B. From ensuring your application perfectly matches your valid ID to bypassing weird technical hurdles, my entire goal is to provide one-on-one expert advice so your application process is completely seamless.
Which brings us right to our final point today. You really don't have to figure this all out alone. Ask yourself, are you ready to stop paying for all that corporate overhead and finally start participating in a genuine community of care? Ready to see if Medi-Share is a fit for your family? Reach out to me at 678-404-9230 or click the link in the pinned comment for personalized one-on-one enrollment support. I am absolutely here to align your healthcare with your values. Thanks so much for joining me for this explainer, and I really look forward to speaking with you soon.